Welcome. Welcome to this session on drug for erectile dysfunction. I'm Dr. Ahmed Nawaz Khan from School of Pharmacy. This video lecture is for instructional and educational purpose only. This is not a medical suggestion or advice. What is erectile dysfunction or ED? This erectile dysfunction is the inability to get or keep an erection firm, which is enough to have sexual intercourse in the penis. Erectile dysfunction in the penis can be occur because of problem at any stage of the erection process. What is this erection basically in the penis? An erection is a result of increased blood flow in the penis. Blood flow, which is usually stimulated by either sexual thoughts or direct contact with your penis. So this erection ends when the muscle contract and accumulated blood can flow out through the penile veins, which are the penis veins. So what are the causes of this erectile dysfunction? So there are many different factors which affect the erectile dysfunction. That is the vascular system, nervous system, endocrine system. Although there are some other factors which may be related to the age and daily routine, food habits. Certain conditions in which lead to the erectile dysfunction are the type 2 diabetes, heart and blood vessel disease, high blood pressure, chronic kidney disease, multiple sclerosis, atherosclerosis, and so forth. Men who have diabetes, they are 2 to 3 times more likely to develop this erectile dysfunction than the men who do not have diabetes. This erectile dysfunction can be a result of taking some medicines, just like with the blood pressure medicines, anti-androgens medicines, antidepressant medicines, some sedatives, tranquilizers, and some appetite suppressant. These medicines, they lead to the erectile dysfunction. In some certain physiological or emotional conditions also, this ED may take place. That is fear of sexual failure, anxiety, depression, low self-esteem, etc. Now, is there any erectile dysfunction treatment? Yes, there are some treatments, some medications which are used, just like the Sildenafil, Tadalafil, Sildenafil, Evenafil. These are some of the drugs or medication which are used to treat the erectile dysfunction. Some other therapies which are used for the erectile dysfunctioning, they are talk therapy to relieve from the stress or anxiety or depression, some vacuum pumps, etc. So whenever a man having a trouble getting an erection or difficulty in maintaining an erection during the sexual activities, or he reduced interest in sex, it indicates the symptoms of the erectile dysfunction. Also, the premature ejaculation or delayed ejaculation is also the sign of the erectile dysfunction. There are some tests for checking the erectile dysfunctioning. Also, they are the blood test, uh, diabetes, heart disease, thyroid, and level of the testosterone. Ultrasound can be done, and there is a test which is known as nocturnal penile tumescence, and NPT test, and urine test. Doctors recommend some of the exercise on this, which are the Kegel exercise, aerobic exercise, yoga, for coming out of this erectile dysfunction. Some food which are which reduce the risk of developing the ED. They are the whole grain, vegetables, fruits, uh, etc. Now let's discuss what are these drugs, what are those drugs which used for the erectile dysfunction treatment. Very prominent, very important drug in this category is the sildenafil. It's available in the market in the form of salt, sildenafil citrate. This drug belongs to a class of organic compound which are known as benzene sulfonamides. They are the organic compound containing a sulfonamide group which is S linked to a benzene ring. This sildenafil is a phosphodiesterase 5 PDE inhibitor, and it is used or indicated for two primary functions. One is for the treatment of the erectile dysfunction, and second is for the treatment of pulmonary hypertension. The mechanism of action of this sildenafil is that this drug ultimately prevent or minimize the breakdown of cyclic guanosine monophosphate, CGMP. How? By inhibiting the CGMP specific phosphodiesterase type 2, type 5, which is an enzyme. The result of doing so, it allows the CGMP, which is present in both the pannus and the pulmonary vascularization, to elicit smooth muscles relaxation and vasodilation, which ultimately facilitate the relief in the pulmonary artery hypertension and increase the blood flow, and gives into the spongy erectile tissues of the pannus, which consequently allow to grow in size and become erect and rigid. This is how the sildenafil works. The physiological mechanism involved in the action of this sildenafil is responsible for the erection involves the release of the nitric oxide. Nitric oxide release in the corpus cavernosum during the sexual stimulation. This nitric oxide, it then activates the enzyme guanylate cyclase, and this result in increased level of cyclic guanosine monophosphate, that is CGMP, producing the smooth muscle relaxation in the corpus cavernosum and allowing the inflow of the blood in the pannus. The half time of this sildenafil observed is approximately 3 to 5 hours, and the maximum dose a person can take from 200 to 800. Interestingly, the adverse effect of 200 and 800, they are very similar, but the intensity may vary depending on the dose. Now, the next compound for the erectile dysfunction treatment is Tadalafil. This drug belongs to a class of organic compound known as beta carbolines, and these are the compound containing 9 hydrogen at 9 position pyridoindole moiety. So we can say it's an indole derivative or under the subclass of pyridoindoles, and the direct parent is beta carbolines. Along with the treatment of the erectile dysfunction, this drug tadalafil is also used in the benign prostatic hyperplasia, also in the pulmonary artery hypertension. This drug is orally administered to treat the male erectile dysfunction, which is sometimes known as the impotence, and in the market worldwide it is come under the brand name Cialis. Like the sildenafil, it is also a phosphodiesterase 5 inhibitor. But importantly, the tadalafil, it is distinguished from the sildenafil in some pharmacologic features, as it has a very longer half-life. Sildenafil, which has a half-life of 3 to 5 hours, while the tadalafil has a half-life of around 17 and a half hours. And because of this longer half-life or the longer duration of action, this tadalafil also known as by the nickname weekend pill. This is about the tadalafil and sildenafil for the treatment of the erectile dysfunction. Thank you.